I think, like quite a few public health physicians, I saw from the beginning that this was an insane response, but it was hard to find anyone who would listen, who you could talk to, because of the whole censorship and the whole...
Great short conversation here I had in Fatima in Portugal at the International Pandemic Management Summit, and the links are down below to the Odyssey channel where you can see all 3 days of the summit, all the professors, doctors and speakers. But this one is with Dr. David Bell. He's a public health physician. He worked for nearly 10 years with the WHO on malaria diagnostics, etc. And he has huge experience. So he gives a background to what maybe went wrong with the WHO and other bodies. And we get through other aspects of the pandemic and shed some light on them. So enjoy. I'm here in the S Divine Hotel in, where are we, Fatima? Near Lisbon in Portugal. So a beautiful place at the International Pandemic Conference. So it's full of professors, doctors, all kinds of specialists discussing the COVID era and what we can learn from it. And I finally met David Bell, Dr. David Bell. Great stuff.
It's good to meet you.
And just a brief summary of your kind of background and history, because you're pretty heavy in virology, you've been in the WHO campaigns, and you've even dealt with Bill Gates himself, I believe.
Well, yeah, I'm a public health physician originally from Australia. Did a PhD in disease modelling and infectious disease, etc. Worked in the World Health Organization for about 8 years in the malaria diagnostic side, so looking at how to get diagnosis and community-based management out to, sort of village level in malaria. And I was involved in the first SARS outbreak at that time, so very early on when SARS came out of Hong Kong and Vietnam originally. So then I led the malaria and fever at Foundation for Innovative New Diagnostics in Geneva, which is a foundation funding diagnostic development for low-income countries, and I was Director of Global Health Technologies at Global Good Fund, which was Bill Gates' sort of development lab in Seattle, technology lab, for trying to get health technologies out to low-income countries. And yeah.
Excellent. So you have a great perspective. So when SARS-CoV-2 came along then, and in your talk yesterday, you went through a lot of the changes in the WHO, that you kind of defended the WHO originally as an organization, but then it shifted hugely, it appears, as we entered in the SARS-CoV-2 era.
Yeah, it's interesting, and trying to figure out what's happened. But I mean, intrinsically, WHO is a good idea. I think it's people worry about centralisation, etc. But there are a lot of countries in the world that still benefit from WHO presence in technical support, and you need somewhere where the world can share information and set certain standards that you'd like countries in general to follow. So intrinsically, I think WHO is set up for good reasons. WHO is, in theory, a good idea, or at least a central health organisation that can help to coordinate between countries and support countries when they ask for help. The original concept of WHO, it was funded, it had a core budget assessed from countries. It has the World Health Assembly, which is one country, one vote, which sets policy. And it was a technical agency. Countries would allocate money. The technical agency would decide how best to use that money, guided by the countries, which is the World Health Assembly. So it's a sort of democratic-ish sort of concept, that country-based, and it was very focused on health is not just physical but also mental and social well-being. So that means you're not just trying to get rid of a virus, you're trying to improve society as a whole, the communities, and that was very much driven by the concept of a community-driven control over health. And this was, the basis of public health as I was taught it. So Well, I think what has changed is that about 20 years ago we started having the idea of a public-private partnership and private money coming into this. And in theory it seems a good idea because, gee, more money for, diseases like malaria, tuberculosis, HIV, etc., where the main problem is actually access to existing diagnostics and drugs. If you have more money, you can buy more, you can help more people not to die. It's a good thing. But what happens with the private money always comes with some tags. And if you're a private company and you're giving a lot of money, you can really only do that if you think that you're going to get a return on your investment for your investors. That's what a private company has to do. So we had this idea that I think we were a bit blinded in global health that just getting more money would be a good thing. Whereas it's slowly eroded the idea of avoiding conflict of interest, keeping communities in control, keeping private companies at arm's length. And it gets to the point where suddenly a large part, or in some parts of WHO, most of the funding, is from private companies or private individuals, in fact. And they can be very directive in, we will give you this money for hiring these people for this purpose to do this, and we would like to see these sorts of outcomes. And so suddenly your salary and the salary of your team is dependent on pleasing a private individual, not pleasing all the countries that are supposed to be collectively guiding WHO. So, that in some ways it's slightly simplistic, but that's essentially what's happened, I think. So we've got to a point now where WHO is, and there are other health organisations that have grown up at the same time where private organisations are on the board, like Gavi, which is a vaccine alliance, CEPI, which started at the World Economic Forum, the World Economic Forum about 5 years ago, and that's purely for pandemics and mostly for vaccines for pandemics. Mm-hmm. And the boards of these organisations, which have budgets similar to WHO and work very closely with WHO, they include these private companies and private entities who are for-profit people or for-profit companies. So we now have this whole international health infrastructure that's very tied to large corporations and very tied to people who need to make a profit to please their shareholders.
Yeah, so essentially it's a classic case of, if you will, regulatory capture. At a fairly high
and
scale.
It's more than regulatory. It's regulatory is just a barrier you put in place to check something from here is okay when it gets to there. This is actually the getting to there bit. It's the whole policy. So rather than concentrating now, the focus has moved in global health from trying to improve community well-being, trying to improve nutrition, which will reduce malaria, reduce TB, reduce HIV, etc. And trying to get the commodities available for people to use is shifted to essentially outbreaks, pandemics, and preparing for them, and giving a vaccine to everyone when that happens. And you can see why, because it's very hard to monetize getting more community health workers out to Burkina Faso or somewhere. But it's very easy to monetize getting everyone in Burkina Faso to have a vaccine.
And I see it essentially as it's kind of pandemic profiteering, and it's a very high margin business. I mean, incredibly high margin, lucrative business for the right players. And I often think of that famous, I can't think of his name now, a bank robber in America, and the famous line was, they asked him, but why do you rob banks?
That's where the money is.
Because that's where the money is. Yeah. So there's no conspiracy theory here. It's just a reality that industry and corporates have essentially taken over the business of pandemics. Yeah. You went through this vaccine element, I forget the name of the organization, COVAX. And they had a slogan which just epitomizes what we're talking about, and you gave
four, I think, bullets as to why that was kind of absurd, but made absolute rock solid sense for the businessman.
Yeah, so no one is safe until everyone is safe, yeah? And so this is the slogan for COVAX. COVAX is a funding facility for trying to vaccinate the world against COVID, and it's particularly, it's a funding facility for low middle income countries. It has, I think, $7-8 billion so far, which is twice the annual budget of WHO for everything. And yeah, so no one is safe until everyone is safe. So, and what it's trying to say is we have to vaccinate everyone, get as much vaccine out as possible. So, but if you pull it apart, it's saying, if no one is safe, then the vaccines, I vaccinate you, you're not safe, which means the vaccine's not working, because vaccines are supposed to protect you, yeah? And until everyone is safe, is trying to say if you vaccinate everyone, that'll protect you. But we know the vaccine doesn't stop transmission. So, and no one is claiming it does anymore. So the slogan is a nonsense. It also is, if no one is safe, it means that everyone is at high risk. Half the African population is under 20, and they're extremely low risk, which is why almost no one now is dying in Africa from COVID. Very, very low mortality. So yeah, the slogan is a nonsense, but it is repeated on the UNICEF website, the Gavi website, the CEPI website, World Economic Forum is into it, Wellcome Trust. It's in published papers, and it's stated, it's one of these things that's stated just as, if you say a lie enough times, it becomes a truth. And the whole pandemic thing, there's a lot of that. So, we're told on the same websites that pandemics are becoming more common. But WHO's own publications show, it's the Spanish flu in 1918-19 killed a lot of people. Then 1957, so 2 generations later or a generation later, there was the Hong Kong flu, I think, and then the Asian flu, 68, 69. They killed 1 million people each. Tuberculosis kills 1.5 million every year. So these 2 pandemics killed 1 million each. Less than tuberculosis. They called a pandemic the swine flu, which killed between 100 to 150,000 people in 2009. Seasonal flu kills about 500,000 every year. So this was less than a normal flu, but they called it a pandemic, and that's it before COVID. So a pandemic is something that comes once a generation. If you put it on a yearly basis, it kills maybe 100,000 people on average, if you average them out over the years. That's less than most other infectious diseases.
And certainly overwhelmingly less than the real diseases like heart disease, cancers, Alzheimer's.
Way lower than...
I got a pie chart recently for a talk I gave in Ireland. And I just did the pie chart of what causes death. And the transmissible diseases were just a tiny sliver. It's extraordinary to look at visually, and yet, but that's where the money is, like the bank robber. So in Ireland, just to your point about Africa and COVAX, yes, half of Africa is under 20, but Professor Ioannidis' latest data puts the under 70s at around 99.9% survivability. And in Ireland, which has good data, we've been through 2 years of pandemic, government data, under 70s had a 1 in 8,000 risk over 2 years. I mean, it was 99.98 something survivability in real world data.
And that's averaged over all under 70s. So if you're healthy, and most of those have at least one comorbidity, average about 2 or 3. So a healthy under 70.
It's effectively 0, and a healthy under 50 certainly, and under 30 just bona fide proven.
So you translate to the African context, and you've already got 95% of the population almost zero risk, and most of the rest, that 5%, very, very low risk. You've got 1% over 70, less than 1% over 70, and very few of them are obese So, yeah. And that's what we see in the data from Africa. But we also see increasing malaria, increasing TB, increasing HIV because of the effect of lockdowns, which everyone knew. WHO predicted its inevitable result of locking down. We've locked in poverty for the next 2 generations by closing schools for up to a year or 18 months in many countries.
So every logic and cost benefit wasn't just broken, it was defiled.
It was insane.
Insane.
I mean, you can argue in some Western countries and some populations, maybe it's here or there. I mean, I think clearly lockdowns are overall it's negative in the West as well. I mean, that's becoming increasingly clear. But in Africa, there was never a question. But because everyone is so young, most people are so young, half the population under 20. So, we see the BBC or someone will have some, scientists baffled by low mortality from COVID in Africa. But we knew in March 2020 the age distribution of COVID. You just had to sit down with the United Nations population data and you could work out what was going to happen.
But again, this was never about logic, this is back to our earlier conversation. This is now a business, and it's an extremely high margin business with a massive addressable market because everyone needs to be treated. Politico recently, interestingly, which is mainstream, actually did an article that was very provocative and very accurate, really. And they said basically Bill Gates, and they named him, and 4 other key organizations essentially took over the pandemic management, lock, stock and barrel. And they detailed how that actually happened. That's not, though, hitting any mainstream except for that one Politico article.
Yeah, so I think you can say the private sector has taken over. Yeah, I mean, I don't know whether it's an individual or whether it's mainly institutional. There's a whole industry there that's taking over. And, if you go back, the New York Times is owned by the main investors and shareholders in the New York Times are the same as the main investors in Pfizer, for instance, and Coca-Cola and it's CNN, etc., which is Vanguard and BlackRock. State Street, these big investment houses. So I think in some ways it's a huge business transaction. You have these huge investment houses now that control Western corporate life, and they have a responsibility to maximize income for their investors. So if you own the pharmaceutical industry, you own the media, you have effectively investments in the global health world, then you have a responsibility to your shareholders to use those to maximize return, which means ignoring these major diseases that kill a lot of people, but it's hard to monetize, and concentrating on something like pandemics, which are rare, but where you can essentially print money by. You can find a viral variant, and the pandemic preparedness agenda, that's what that's about, is increasing surveillance. You'll find variants always. You can always say there's a chance this virus could cause an outbreak. We know it's actually once a generation or less, and usually not a very bad one, but you can say it could cause an outbreak, therefore we need to lock down and vaccinate this whole region. And you've just printed a few $1 billion. It's a sensible thing to do from a business point of view if you've got no morals.
Absolutely, and to be honest, discussing morals with that high level of business is an absurdity in itself. Of course there are no morals once you reach those levels. You had to leave those behind at the door. But so you profiteer, but the other thing is the oldest con trick in the book, and it's the rain dance con trick. That you put in all the measures and then nothing particularly happens, and then you credit the measures. So you take credit on the con.
Well, of course. I mean, you get a viral, you detect a variant in, let's make up, X-stan, yeah? And so you lock down the country, you vaccinate everyone. and the variant doesn't take over, it doesn't destroy the world, and you say that proves that lockdowns and mass vaccination work.
This is a challenge.
And no one can refute that, because you can't prove that it wouldn't have caused a bad
absolutely.
outbreak.
And
I mean, historically, you could say it's incredibly unlikely. It's like a meteorite hitting Earth, but you can't prove that meteorite wouldn't have hit Earth.
And you know what, that just reminds me again of that crucial thing. Well, two things, David. One is, of course, they made massive efforts to eliminate a vaccine control group in this scenario, because they knew that control group may show up that very little was impacted. But Sweden did persist, and luckily for all time now, the data's in, Sweden has one of the lowest impacts in all of Europe, even with an aged demographic like UK, way higher yearly mortality than Ireland because they're aged. No lockdowns, no masks, kids in school throughout. We have CNN video of May 2020. They did not lock down worth a damn. They proved that lockdowns and masks and school closures are nonsense, or as close to nonsense as makes no difference. But no one really knows this. And do you think there's going to be more lockdowns, even though it's scientifically proven to be insane?
Yes, definitely. And Sweden's interesting. So a lot of people will say, yeah, but Norway. But the Oxford University has their lockdown index. And you may know, actually, I think it was late 2020, early 2021, they suddenly changed the criteria to make Sweden look as if it had lockdown. But in the process, they made Norway have a lighter lockdown than Sweden.
I know.
So, but I mean, the fact that all of Scandinavia had very light lockdowns, and they all did pretty well.
And the mortality data is just out, and they showed it in a recent talk in Amsterdam. It had just come out, and in 2020, Sweden in excess mortality was one of the best in Europe, but it was a little higher than the neighbours. 21 then it was blurred, and in 22 the other three Nordics are way up, and Sweden's almost negative.
Yeah, and I think a lot of that is because we see. I mean, it was clear in Western countries, and I like many, I think, or some were, writing to journals pointing this out and wondering why it wasn't published. But it's not complicated. If you stop cancer screening, if you stop chemotherapy for people with cancer, if you stop seeing people with chest pain, then you will increase mortality. There's a reason why we do cardiac catheters and screen for people with chest pain. There's a reason why we do cancer screening, because we think it reduces mortality. So you stop it and mortality goes up. So when we locked down for months in 2020, we knew we were increasing mortality. That's leaving aside the fact that we know that poorer people die sooner. The social capital is a real thing. The people with lower social capital on average die earlier than people with high social capital. Wealthy people live longer than poor people. And so we know that when we impoverish people, we stop their employment, that on average they will die sooner. And they will have more cancers and a whole range of other morbidities that are associated for some reason with poverty. So, this is public health 101. It's not complicated. So, obviously we're seeing what we expected now. We're seeing 2-3 years later an increase in mortality due to the effect of lockdowns. And it's easy to ascribe it to the vaccine or some other, but we forget we knew this was going to come. We built it into the system. And now, we've also sacked huge numbers of health workers. We've discouraged people from going to GPs I know in the UK, I think it's hard to get a GP appointment now. You have to go on the phone. I mean, that's just ludicrous. As a doctor, someone comes in with a sore foot. It's not actually the sore foot half the time that brought them in. There's something else that they want to talk about. You can't do that on the phone. You need to see someone face to face to figure out what is really wrong with their health.
Of
So
course. So crazy times. Well, we have to get back to the conference, but that was a great discussion, recapping on everything. And just a quick check, you worked with Pandata from early on, I think. You're quite linked to them. And Nick, of course, all the ladies love Nick. I mean, it's hilarious to watch.
One of the reasons I actually got involved in Pandata, I think I saw you and Nick Hudson having a chat
the
online,
interview.
and the interview, and that's how I became aware of I was aware of Panda's existence beforehand, but I think like quite a few public health physicians, I saw from the beginning that this was an insane response, but it was hard to find anyone who would listen, you could talk to, because of the whole censorship and the whole sort of fear. There's a fear thing in my colleagues that if you question this, what's happening, you're a far right extremist, or you're in the US a pro-Trumpist or something weird like that. I mean, I don't know. I've always been on the left side of politics, but it's lonely these days, I think. So,
It's crazy, and I was traditionally left of centre in low carb world a few years ago.
Yeah.
I was accused of being a socialist, a communist, because I supported socialised medicine. I tended to be left of centre, and then when COVID came and I began to just tell the truth about data, I was suddenly right wing. It was insane. Same person.
Socialised medicine is not closing the clinics and forcing everyone to stay home. So
that's it.
Yeah.
So there we are. Great stuff, David. Great to meet you. Good
Thanks.
man.
Good to meet you, Ivor.
Thank you.
Well, there you go. So do see the links below to the channels where you can watch the professors, doctors, public health specialists who came to Fatima near Lisbon in Portugal for the International Pandemic Management Conference. So fantastic discussions and data, and at the links down below, all will be available in the coming days. So do catch up on all of that fantastic material.